Hey everybody, Buck Buckminster with 360 Louisville, back here at the Getty Eye Center with Dr. Laura Lea Bassett. Dr. Bassett, good to meet you today.
Likewise, Buck.
I'm really looking forward to having a chance to learn from you because we visited earlier and you were sharing with me about a lot of things. And not only before I got here, I realized that you were recognized as one of the most astute eye care physicians in this area, but you also have an interest in helping others like myself understand about preventative eye care, what we can do to take better care of our eyes. So tell me a little bit about that, would you?
Of course, certainly. One of the best things that you can do is to have an annual eye exam by an optometrist, because we're specialized in not only determining the refractive nature of the eye, which is the vision aspect, but also we strive to uncover any hidden eye problems or diseases. And I personally like to spend a lot of time educating my patients about things they can do in their own life to prevent future problems, particularly if they have medical issues already like diabetes. Also if they are contact lens patients. What I've found over time is that not all contact lens patients are fully educated about how to proper care for their lenses and about simple things that they can do, such as washing their hands every time they handle the lens and even dumping out the old solution in the morning. We find upon evaluating problems, when I ask further questions, a lot of patients just have never been educated about exactly what to do and what not to do. So I really find that spending a little extra time with a patient and educating about simple things can help prevent a lot of further issues.
Okay, wonderful. So for an individual like me that knows nothing about eye care, anything that I can do to take better care of my eyes?
Well, ultraviolet light protection is a big factor.
Okay.
We have learned that UV exposure can increase the risk of having certain diseases later on, such as cataracts and macular degeneration.
Right.
So that's a simple thing that can be stylish as well.
Yeah, well, you guys have an incredible selection of, sunglasses out there in your showroom, and I was just wondering, is there a difference in lenses? Because, there's always a difference in price. You guys have all price ranges, I guess, if you will, out there, but is there really a difference in lenses when it comes to sunglasses?
The most important thing to look for is protection from 100% of UVA and UVB rays. Secondary to that, the quality of the lens will come into play with price. If you pay more for a lens, you'll definitely get better quality in terms of less optical distortion and just a clearer image. But those are really the most important things, especially the ultraviolet light protection.
Okay, wonderful. Dr. Bassett, I've got several family members that have diabetes, and they're incurring all kinds of eye problems now. What should they have done prior to their diagnosis of diabetes to maybe offset some of the challenges associated, with the diabetes in their eyes right now? Or what should they be doing now? Can you address that for me?
Sure, Buck.
Okay.
Once a patient is diagnosed with diabetes, probably the most critical factor is having an excellent primary care physician or internal medicine or even endocrinologist who communicates with the patient about where they stand from a medical perspective, especially knowing what they can do to help control their blood glucose better and to help prevent further problems. On my end, it becomes educating the patient to have a yearly eye exam. There are specific things that we look for, such as bleeding inside the retina or fluid leakage in the retina. Those types of issues are what over time can cause vision loss that can be irreversible. So if we see those problems early on and can address it with the patient and with their managing physician before it affects their vision, then frequently steps can be taken on a systemic level to better control the disease to help prevent those types of problems. If a patient waits until their vision is really affected by diabetes, it's often too late to really bring back what they've lost. So there is a continuum of problems that can happen with diabetes, from very mild issues that don't affect vision to really extreme legal blindness type problems. We hope to see the patient in the early part so that with proper education and management, we never reach the end of the severe problem.
Can you actually, through an eye exam, diagnose me and find that I'm diabetic for the first time?
I can find suspicion of diabetes, often by findings in the retina. That's seen when we either dilate the pupil or evaluate the retina with an optomap or a digital image. So sometimes I'll see suspicion of diabetes and will refer the patient to have further testing, and that's often confirmed. So often we are the first people to really suspect
Right.
it even before the patient has symptoms.
Right.
So that goes along with just having a yearly eye exam where things such as diabetes can be found, even serious issues like that.
Right. So in the same way that I go to the doctor every year for a physical, I go to the dentist every year to have my teeth cleaned and have my teeth checked, I need to be getting an eye exam every year as well, don't I?
Yes, you do. Even if you have great vision, because
Right.
there's a whole other aspect of ocular health that is apart from just having vision.
Yeah, incredible. Everything that we learn every day. Dr. Bassett, my grandmother, just before she passed away, she had developed cataracts so severely that she had lost the eyesight in one eye and was losing the eyesight in the other. Is there anything that we can do, you can do? I was told it was genetic. I was told that you're just going to get those one day. Can you recommend or suggest that I might do anything to take better care of my eyes to see that I don't get cataracts?
Well, it's true that if most people live long enough, they will develop a cataract to some extent. Wearing sunglasses, again, will come back to help in that. Not necessarily prevent, but hopefully lessen the magnitude of the cataract.
Okay.
Fortunately, of all the problems that happen in the eye, cataract is fixable with surgery. It's usually an outpatient procedure, pretty quick. The patient isn't put to sleep. Their eye is numbed with a drop, and we have excellent results with that post-operatively most of the time. So it's a fixable issue. Certainly you don't want to have eye surgery unless you need it, but wearing proper sunglasses would help that. Smokers also have an increased risk of cataracts, so not smoking is always beneficial, and certainly trying to quit if you're smoking currently would be advisable. Also, smoking increases the risk of macular degeneration substantially. That's an eye disease that older people can get that affects the central vision and can cause devastating problems with that, and there is no cure currently for that.
Interesting. Well, Dr. Bassett, it's been a pleasure visiting with you today.
Thank you.
Look forward to seeing you again sometime.
Thank you very much.
Thanks very much.
All right, great.
Bye-bye.
Bye.